Okay, good evening, everybody. And today we're going to be starting the bone tissue. You know, we started with the subatomic particles, even below the atom. Those were the protons, the neutrons, the electrons. Then we moved up the ladder, the hierarchy, and we went from subatomic into subcellular compartments. Examples of subcellular compartments. These were your organelles, the cytoplasm, the cytosol, the nucleus. Then we looked at the cells. Then we went up even more, talked about the tissue, which is a collection of cells of the same type, structure, and function. We talked about 4 different types of tissues. Those were the epithelial tissue, followed by the connective tissue, and then we're going to talk about the muscular tissue, and lastly, the nervous tissue. And then we went into the integumentary tissue, integumentary system, not tissue, integumentary system, because a system is a collection of different organs and different tissues. And we learned that the integumentary system has epithelial tissue, that's on the epidermis. It has connective tissue on the dermis. It has different variety of vasculature that is on the basement membrane. And we learned all about the structure and the function of the integumentary system. Now we're going back to bone tissue, because after bone tissue, we're going to move on to the skeletal system. So before we learn about the skeletal system, and as I said earlier, the skeletal system is a very descriptive type of system. So it's no more a lot of concepts to understand. Now it's brute memorization. It's either you know the humerus or you don't. There's no partial credit. There is no thought process. That's a descriptive field now. So you have to master all the skills that come with anatomy and physiology. You have to memorize the bones. You have to memorize the structure and the joints. But I gave you that guide that helps you on McGraw-Hill Connect, and you will do excellent on the exam the earlier you start. So before we go into the skeletal system is actually a combination of, if you ask anybody what is the skeletal system comprised of, they will say bones. That's not entirely true, because it's a system. It cannot be made up of one type of tissue, just the bone tissue. There's ligaments, there's tendons, there is cartilage. So all of that is part of your skeletal system. But the predominant structure in your skeletal system is your bone tissue. So the skeletal system is composed of the bones, the cartilage, the ligaments, and osteology. We learned in the integumentary system that we have dermatology, so the knowledge of or the study of the skin. Now we have osteology, the knowledge of or the study of the bone. And we're going to learn about osteocytes. Remember, we did cytology, that's the knowledge and the study of the cell. Very good. That's cytology. Now we have osteocytes. Osteocytes, meaning that these are the cells of the bone tissue. You must remember, very high yield concept. What's the difference between ligaments, and what's the difference between ligament and the tendons? Ligaments always cover the joints, so that tells you they connect bone to bone. Because if ligaments do not connect bone to bone, they will not be all over the joint where there's a junction, there's a joint between two, there's an articulation where two bones are articulating and uniting at a joint. And the tendon attaches the bone to a muscle, Now, we looked at the structure of the bone or the skeletal system. What's the structure of the skeletal system again? What's the anatomy of the skeletal system again? Bones, tendons, ligaments, and cartilage. Very good. So we're not only doing anatomy, we're doing anatomy, structure, and physiology, function. So now it's time to look at the function. Your skeletal system is responsible to provide support, tensile integrity, mechanical strength, The limb bones and the vertebra, they support your body. They help you hold your own, stand up. Your jaw is like the root at which your teeth are anchored. And some bones, they support your viscera. We talked about this concept before. You need to know what's the viscera. What's the viscera? viscera. What's the viscera? A viscera is a soft tissue, such as your lungs, your brain, your heart, your urinary bladder, your intestine, your stomach, soft tissue. Is your bone tissue viscera? It's not. Are your ligaments viscera? Are your muscles viscera? So what do we call the tissue that is not viscera? What do we call that? Somatic tissue. Somatic tissue that is tough tissue. You realize that your bones are protecting who? Somatic tissue or visceral tissue? Visceral tissue. You prove it to yourself. Your skull is protecting who? Brain. Oh my God, back in elementary school, we had a teacher. He would knuckle your skull if you don't do your homework and all that stuff. That thing hurts up to now. So the skull is encapsulating the brain. Your rib cage is encapsulating and supporting your lungs and heart. Your vertebral column is supporting the spinal cord. Your pelvic girdle is protecting your urinary bladder. So you see it has a protection role. Movement. We march and we move for the limb movement. Breathing also. You know, these intercostal muscles, you know, the rib, you know, people eat rib steak. So you see that between the bone is the meat, that's the muscle. The meat is the muscle. So those are intercostal and extracostal muscles. When you breathe, your bones crush and they contract and they squeeze your lungs so air comes out. And when you want to inhale and bring air in, they relax, they dilate, and they expand your transverse diameter of the rib, or your transverse diameter of the rib cage, and that leads to the increase the volume of your rib cage, which allows air to enter into your lungs. So bones participate in breathing. Who makes bones stretch? The muscles. So the nervous system would send electrical action potentials to stimulate the muscles. Muscles contract, air come out. Brain sends out action potentials to cause repolarization, relaxation of the muscles, then bones relax. So bones obey who? The muscle. Bones listen to the muscle. You extend it, you flex or you extend your bones because your muscles are the ropes who pull the bones, the levers. But your muscles obey who? They obey the nerves of your brain. So the nerves and the muscles are excitable tissue, and the excitable tissue influence the bone tissue. Bone is what type of tissue? And if I ask what type of tissue, I'm looking for one of four answers. Epithelial, connective, muscular, or nervous tissue. What do you think bone tissue is? What is bone tissue? Maria. Laura. What is bone tissue? What kind of type of tissue is bone? Yes, connective tissue is the only one that's left. It's not epithelial, not part of the skin. It's not nervous because it's not excitable. And it's not muscle. It's all bone, so there's got to be the last one that's left by process of elimination. It has to be connective tissue. So it's important for movement. Electrolyte balance. You know this bone is like a mountain of calcium salt, crystals of calcium salt, phosphate salt. You know the bank, if you want money, you go to the bank, you withdraw money. And if you have too much money, you go to the bank, you deposit the money there. Some of us have more trips to withdraw, others have more trips to deposit. Others have the same rate. So there's different categories of people. But your bone tissue is just like that. How? When your calcium drops, we scratch the bone tissue and we liberate bone powder rich in calcium, rich in phosphate salt, and then the calcium level goes up. If the calcium level is too high, we do the opposite. We take calcium from the blood and we dump it on the surface of the bone. So we withdraw minerals from bone when we need. We deposit minerals in bone when we have too much. So when there's hypercalcemia, do we deposit or do we degrade bone? When there's too much calcium, we deposit. Because we have too much calcium in the blood, we deposit it in the bone. When we have too little calcium in the blood, we withdraw from the bone. You got to learn that there's two cells that do that. If you want to build up, BB. If you want to build up, you use osteoblast. If you want to build bone, you use osteoblast, BB. And if you want to cut bone, you want to degrade bone, you use osteoclast. And they are enemies. They're enemies. They don't ever work at the same rate. If you have too much calcium in the blood, you turn on osteoblast and you turn off osteoclast. If you have too little calcium in the blood, you turn off osteoblast and you turn on osteoclast. Women suffer from menopausal osteoporosis. Men suffer from senile osteoporosis. Well, from the name, osteoporosis, what does osteoporosis stand for? Osteo is bone, porosis. Cis is a disease, osteoporosis is a osteoporosis, meaning that there is pores, huge pores in the bone. So the bone starts off like a sponge, but now it has so many holes in it. Does that weaken the bone or strengthen the bone? Weakens the bone. So why do women have menopausal osteoporosis? Because the decrease of estrogen. Estrogen is an essential hormone. What does essential hormone mean? It gives you your essence. You know, the boys become men because their essence of a man is because of testosterone hormone. Girls become women, their essence is now an essence of a woman because of the estrogen. So they brought 4 female rats. 4 female rats. These 4 female rats, they injected them, they removed their ovary. So when they remove the ovary of all the female rats, what do you expect happens to their estrogen? You think female rats don't have estrogen? Every female has estrogen. Not all the human females. Every female out there has estrogen. Now, if you remove the ovary of females rats, what happens to the overall estrogen in the blood of these female rats? Increases. I heard increases. It decreases. So then a week later, they took X-ray of the bone of these rats that they removed their ovaries. What do you think happened to their bone density, the peak bone mass? It dropped severely. They were having the worst nightmare osteoporosis. So then they said, let's do this. Let's add, if we have 4 or 5, they brought 4 or 5, 10 rats with no ovaries. And they said, give the 1 milligram per deciliter injection of estrogen. The second one, 2 milligrams per deciliter injection of estrogen. The third one, 3 milligrams per deciliter injection of estrogen. The 4th, 5th, 6th, up to the 10th. The more you add estrogen, they realized that a week later, when they took another X-ray, what happened to the bone density of these rats? It increased. They became stronger. And in fact, they realized that the more estrogen you add, the more stronger the density. Until they realized there's a ceiling effect. There's a ceiling effect. The ceiling effect means even though we have a correlation, the more injection you add on the x-axis, you have the injection dosage. And on the y-axis, on the x-axis, you have the injection dosage. And on the y-axis, you have the peak bone mass. The more injection you add, the more the peak bone mass. The more injection you add, the more the peak bone mass. Until you have a ceiling effect. Meaning that the more you add is not going to increase the peak bone density anymore. In fact, they realized something crazy happened. It happens in Hollywood too. Yeah, what is it? What happened is that what happens to these actresses who are having a difficult time accepting old age, lamenting age? So they go to the unethical doctors, and the doctor, as long as you pay them and you sign the paper, you are basically your own doctor. You ask, you get what you want. So they were telling them, give me more estrogen, and they were given more estrogen, until they ended up developing breast cancer. And breast cancer is the highest cancer that metastasizes to the bone. And you know, they all had cancer and they died. The same thing happened to the rats. The rats who received too much estrogen, there's a level, there's a line. Once you cross that line, you're gonna get breast cancer. So females who get a lot of estrogen, they end up with breast cancer. Blood formation. Who would have thought that this white mountain, this hard stone white mountain of bone is responsible for making red blood? Yes. When you split the boiled egg in half, you find yellow yolk in there. So when they slice the bone tissue coronally, what did they find? They found red bone marrow and yellow bone marrow. And lastly, your bone is responsible for secretion of hormones. Now, if you look at your body, you have axial skeleton with bones that are the skull, the vertebral column in the back posteriorly, and the rib cage anteriorly, and the pelvic girdle. And then you have the appendicular skeleton, which is mirror images. You have a humerus on the right hand, humerus on the left hand, radius and ulna on the right hand, radius and ulna on the left hand, and so on, double of each. Do you think every single bone does all 7 of those? Support, protection, movement, electrolyte balance, acid-base balance, blood formation, hormone secretion. Does every single bone do that? No. Some bones are known to do 1 or 2, maybe 3, but not one bone is going to do all of them. So you will see that your blood is made at certain places in your body. Movement is regulated by certain bones. And when it comes to memorizing these bones, obviously I gave you the list of the bones you need to memorize. But in general, when it comes to memorizing bones, which is part of anatomy and physiology, memorizing blood vessels, memorizing nerves, you realize that students, imagine somebody knows Harlem, but they have no idea what New York State is. Or they know Harlem and they have no idea what America is. They don't know what North America is. They don't know what planet Earth is. They just know Harlem. Or if somebody knows, 125th Street, they have no idea Madison Avenue. They don't know about FDR, the Major Deegan. So my point is, students get lost in the details. They memorize the real tiny bones. They memorize the phalanges. They memorize the clavicle. And they have no idea what the femur is. They have no idea what the humerus is. So always begin very, very big. This is not wise. Students don't know what the aorta is, and they know the common carotid. That's like knowing 125th Street, and they have no idea what FDR is. The aorta is the biggest artery coming right off your heart. So you have to be wise at the way you do things. Just because you have an intention, you want to study, you want to do well, you have to be smart. How to study, what to study. Back in the day, I used to be like that. I just look at all information with the same priority level. That's wrong. Some information has very high yield. It's called high yield, high priority information. That is where, you know, in the election, they have what they call it? Electoral colleges, blah, blah, blah. You know, no, that's the real blah, blah, blah. You know, some states, they have really big points. They fight over those ones. And the little state, they don't care about them. Actually, that's how it works with studying. There's some concept, very high yield concept. You need to master them. They're going to move on with you to pharmacology. They're going to move on with you to fundamentals of nursing. They're going to move on with you to the NCLEX. And some information is just supportive to that. Okay? So now, let's look at the bone tissue. This bone or osseous tissue is obviously connective tissue that is highly mineralized or calcified, very dense, very tough tissue. So what are the types of bones? We have flat bones. Flat is not like this table. Obviously, it's curved. It's curved. So flat bones are curved plates, slivers, and they protect the soft organs. So you know those flat bones are good for protection. Examples of those would be parietal bones of the skull, sternum, the scapula, the ribs, the hip bones, and so on. Then you have the long bones. The long bones here, these are the bones that are longer than they are wide. They are much longer than they are wide. These are rigid levers that are acted upon by the muscles, and they are crucial for the movement. They're crucial for the movement. Examples would be the humerus, the radius, the ulna, the femur, the tibia, the fibula, and the metacarpals. And some bones don't fit in either category, like the sesamoid bone of your knee, the kneecap. That one does not look short, does not look long, is not either flat, so we call that irregular bone. So we have compact bone and we have spongy bone. Compact bone is the really tough, rigid, highly calcified, mineralized layer of bone that is really tough. You know your bone is not like a baseball bat. You know, if you cut the baseball bat in half, the baseball bat in the core doesn't have marrow. In the core is as dense as it is on the outside. It's uniform on the core and on the outside. Your bone is not like that. Your bone is tough on the outside, but is really soft on the inside, like a watermelon. The watermelon is soft on the or is strong on the outside, but really soft on the inside. So the soft part, the porous part, like a sponge, they call it the spongy bone. And when you look at the long bones, this is just for the long bones. There's a middle lever known as the diaphysis, And then there are enlarged ends, poles, like a North Pole and a South Pole, two enlarged ends. These are known as the epiphysis. Very good. And right between the epiphysis and the diaphysis is a plate known as the epiphyseal plate. That plate is going to get bigger or smaller as you get older. It's going to get smaller. Once it fuses, no more plate, no more gap, no more space between the epiphysis and the diaphysis. Are you going to continue growing anymore? You're not. You're going to stop your growth. That's the epiphyseal line. So in the bone, you have articular cartilage, which is a layer of hyaline glassy cartilage that covers the joint surface and allows the joint to move freely. There's nutrient foramina. These are holes. Nutrient foramina are holes that allow for the entry of the blood vessels. Nutrient, they're there to provide nutrition, to provide oxygen, to provide support, to provide removal of metabolic waste. And there is a periosteum. The periosteum is the outside, most superficial sheath. Is an external sheath and a fibrous layer of collagen. But the endosteum is endo, meaning that it is more deeper, more on the inside. That's a thin layer of reticular tissue. The periosteum is a thick layer of fibrous tissue, while the endosteum is a thin layer of reticular tissue. One is fibrous tissue, one is reticular tissue. You need to know the diplo. You need to know the diplo. What is the diplo? This is very important. What is the diplo? This is a special structure found only in your skull, in your cranial vault. This skull, because it houses your brain, is very dangerous. So usually our bone looks like this. So this is a thick layer, very thick layer. What do we call this very thick layer? That is the compact bone, really tough bone. Compact bone. That's at the surface level. Surface level. Deeper, you have these circles. These holes, spongy bone, spongy bone, spongy bone. You see? Spongy bone, holes, spongy bone. Usually that's how your bone look like. On the top, really thick, compact bone. Right below it, this porous, spongy bone. In your brain, it's not like that. In your brain, there is an additional compact bone layer like a sandwich, like two buns. So you see, there's another bun in the bottom. And that is only found where? In the brain, not anywhere else. So in your brain, you don't just have a compact bone and spongy bone. You have compact bone, sandwich, spongy bone, and another layer of compact bone. There's a double layer of compact bone. Between them is the spongy bone. That spongy bone that is sandwiched in the middle between two compact bone is called the diplo. The diplo. The diplo is the spongy bone that is sandwiched between two compact bone. Only found where? In the brain. There we go. Inner and outer tables of compact bone enclosing a layer of spongy bone in between, called the diplo. So that's a nice diagram here that shows us. You see the two enlarged ends, the epiphysis, and in the middle is the long lever known as the diaphysis. There we go. This is the enlarged end, the epiphysis. That's a perfect place where you have your red bone marrow. And then your lever, your diaphysis, is the house for the yellow bone marrow. What is surrounding the yellow bone marrow? It is the periosteum. You have the endosteum first, and then the periosteum. And there are holes known as, you see the nutrient foramina. Through the nutrient foramina enters your blood vessel. That's why when you fracture your bone, there is a blood tumor, a blood clot that forms around the injury and the breakage site, and it accumulates there like a blood clot because your bone has a lot of vessels going through it. You see, today I starved myself. I only had one sandwich. By this time, I would have had 3 heroes. You see, when you starve yourself, it's healthy. You know, I read an article that the more you eat, the more bacteria in your body are gonna and parasites they're gonna eat it, and the demons they're gonna eat it off of you too. Yeah. But when you don't eat, and when you're hungry, then all the parasites and the demons starve. Yeah. So I'm angel when I'm hungry. Okay, so you see the diplo? Everybody see the diplo? That's the diplo in the middle, and that's the sandwich, the two bones. On the bottom, the periosteum, on the bottom, the compact bone, on the top, the compact bone of your skull. Osteogenic cells, from the name, osteogenic. The osteogenic cells, these are stem cells that make osteoblasts. We already mentioned what osteoblasts are. BBB, osteoblasts are bone building cells. Osteoblasts are bone building cells. How do they become bone building cells? They are the product of the stem cells known as osteogenic. Osteogenic cells give us osteoblasts. Then the osteoblasts make bone, known as osteogenesis. You know, we have osteogenesis, angiogenesis, hematogenesis. Genesis means what? Not the beginning. Not the beginning. That's in the Bible. It means the beginning. It's not the beginning. It's the beginning of the creation. That's true. But Genesis means the creation, the making. So you have osteogenesis is the making and the creation of the bone. Angiogenesis is the making and the creation of the blood vessels. Hematogenesis is the making of the red blood of the blood cells. Osteocytes. Osteocytes, these are retired osteoblasts. You know, osteoblasts, they don't make bone forever. They get too tired. So when they retire, they're now called osteocytes. These are former osteoblasts that have become trapped in the matrix. You need to know what lacunae and canaliculi. Canaliculi. Some people say canaliculi. Canaliculi. Some other professor was saying canaliculi. Is that true? How do you say that? Canaliculi. So what was the other professor saying canaliculi? It wasn't the one who said blah blah. It wasn't that one. It was another one. It's funny. Okay. So the lacunae these are tiny cavities where the osteocytes gonna sit there for their retirement. These are the lacunae. And the canaliculi, these are little channels. They're not duct, but they're just like duct. Duct is in the soft tissue, in the viscera. The duct-like structure in the bone tissue connect the lacunae to each other. Osteoclasts, we discussed that. Osteoclasts this is really, really, really important for you to know what osteoclasts are. Osteoclasts are bone dissolving cells that are found on the bone surface. They perform osteolysis. There we go. Everybody look there. You see where my mouse is? That's the osteogenic cell. That's the stem cell. It gives rise to our good friend osteoblast. And what does the osteoblast BBB make? What does osteoblast make? Makes bone. What's another way for saying bone? You know, my grandma, she watched Good Morning America. She said bone. But us, what do we call bone? Osteocyte. These are the bone cells. Very good. Osteoclast. You see, they have a comb. This ruffled border. This ruffled border is found where in the ruffled border is found in the osteoclast, not the osteocyte, in the osteoclast. Why do they need a ruffled border? Like a fork. Like you see the fork? Everybody, please look there where my mouse is. Do you see the fork? Yeah. Who has a fork? Osteoblast or osteoclast or osteocyte? Osteoclast. Osteoclast, because they need to go. You see what they're doing? They are scratching the bone. When do they get to work? When we have a deficiency in calcium or when we have too much calcium? When we have a deficiency. So they go, they scratch the bone so that the calcium can fall off of the bone. Liberate bone powder into the bone tissue. Okay, what is the bone tissue made up of? You need to know that hydroxyapatite. Hydroxyapatite is 85% of bone tissue. Hydroxyapatite is 85% of your bone tissue. What is hydroxyapatite? You need to know that. You need to know what is hydroxyapatite. That's 85% of your bone tissue, and that's a really, really tough, strong, mineralized, calcified structure. That what makes your bone really strong and tough, the hydroxyapatite. Is your bone made up of only hydroxyapatite? That's the one that makes it hard. So 85% is hydroxyapatite, but there is 10%. What is it? Calcium carbonate. We have compact bone. We discussed that. Compact bone has concentric lamella. These are layers of matrix surrounding the central Havesian canal. There's a circumferential lamella that is found encircling the inner outer region of the dense bone. And there's interstitial lamella that fill the irregular regions between the osteons. This is what I wanted you to draw earlier. Please look into how the bone tissue looks like. You see those circles? And the osteon has a lot of canaliculi and these lacunae. If you look here, this is how your bone tissue is supposed to look like. There we go. That's our bone tissue. That is what we were supposed to draw on the microscope. So if you had looked at that first before you get into the microscope, you'd be like, you would have been able to see it. But that's like bias because you have like already knowledge. You cannot, I didn't want you to do that. I wanted you to go see and try to draw it as you can see it. But if you had seen this, you'd have been, oh, I know. Let me just draw like dots with circles around them. The lightest of bone slivers, this is known as the spongy bone. Spicules and plates, these are known as trabecula. The matrix is arranged in lamella, but few osteons and no central canal. These are all osteocytes close to the bone marrow. They provide strength with minimal weight, and the trabecula develop along the bone lines of stress. The spongy bone structure in relation to the mechanical stress. You have the greater trochanter, you have the head, the trabecula of the bone, of the spongy bone, the compact bone, and these are lines of stress, and these are the shafts known as the diaphysis. Bone marrow. Bone marrow is the soft tissue occupying the marrow cavities of the long bones and the small space of the spongy bone. We have two types of bone marrow. We have red bone marrow that is known as myeloid tissue, It contains multiple tissues, including hematopoietic tissue. Red bone marrow, that's already is telling what kind of cell product are we going to get from red bone marrow. What do we get from red bone marrow? Red blood cells. Okay. So in nearly every bone in the child. So as a child, every bone is red bone marrow. But in the adults, is no longer. So it's only in the skull. This is what I was saying earlier. Not every bone is hematopoietic. So as an adult, only your skull, your vertebral column that houses your spinal cord in the middle of it, your ribs, your sternum, and some part of the pelvic girdle, and the proximal enlarged ends of your humerus and your femur. So the adult distribution of red and yellow bone marrow. So the adult distribution of the red and the yellow bone marrow. You see here, this is the skull, right? The proximal end of the humerus, the proximal end of the femur, the pelvic girdle. Ossification and osteogenesis. Ossification and osteogenesis refers to the formation of bone, and the bone develops by two methods, both beginning with the embryonic mesenchyme. And we have two types of bone forming mechanisms. You need to know those. We have two separate ways that we make bone. The first one is called intramembranous ossification, and the second one is called endochondral ossification. Both of them are ossification. Both of them are ossification. One is intramembranous ossification, and the other one is endochondral ossification. The first one is called endomembranous ossification. You see, I got confused. The first one is called intramembranous ossification, and the second one is called endochondral ossification. Because even though you are a one baby, some bones are growing through intramembranous ossification, and some other bones in a different part of your body are growing through endochondral ossification. Let's begin with intramembranous ossification. Intramembranous ossification, you see this blue layer here? This blue layer is this glue-like structure that is secreted by the osteoblasts. Osteoblasts are what? Osteoblasts are the bone building cells. These are the cells that make the bone. So they start secreting a gluey-like vomit structure type of fluid that would later hard and become bone. You see it in blue? This is the first vomit that the osteoblasts are going to make. The osteoblasts are going to start secreting, and they're going to start vomiting some bluish-like structure right there known as the osteoid tissue. The next step, there's going to be mineralization and calcification of that tissue. So the osteoid tissue is going to be calcified, and there's going to be entrapment of osteocytes. The honeycomb of the spongy bone with developing periosteum. There's a honeycomb of spongy bone with developing periosteum. There's filling of space to form compact bone at the surfaces, leaving the spongy bone in the middle. So if you look here, you have the deposition of osteoid tissue into embryonic mesenchyme. The calcification of the osteoid tissue and the entrapment of the osteocytes. So the honeycomb of the spongy bone with developing periosteum. You see, and then we find the filling of the spaces to form compact bone at both ends. Then we're going to move from the intramembranous ossification that we see here into endochondral ossification. In the endochondral ossification, what do we notice? We notice that there's a formation of primary ossification center, and there's a bony collar and a periosteum. There's also a vascular invasion or formation of primary marrow cavity and the appearance of secondary ossification center, followed by, at birth, the bone is going to be enlarged with primary marrow cavity, and there's going to be an appearance of secondary marrow cavity in one epiphysis. And the bone of the child with the epiphyseal plate at, this is the distal end, and then you're going to have finally your adult bone with a single marrow and closed epiphyseal plate, unlike the baby that had an open epiphyseal plate. See, those are the stages. There's an early cartilage model, followed by the formation of ossification centers and bony collar and some periosteum at the cortical layer of the bone, followed by the appearance of vasculature, angiogenesis. So there are blood vessels that form of the primary marrow cavity, and there's going to be an appearance of secondary ossification centers. The secondary ossification center is a center at which you will have these osteocytes starting to appear, and then they're going to be secreting the bone tissue, secreting bone tissue. And at birth, you're going to have this structure here with semi-completed bone, but it's not complete yet, with enlarged primary bone cavity and appearance of the secondary marrow cavity in one epiphysis. There's going to be a bone of the child with epiphyseal plate at the distal end. There's going to be an adult bone with a single marrow cavity and closed epiphyseal plate. There we go. This is the most important slide of the lecture, because it shows you that there is intramembranous ossification and there is endochondral ossification. Look at where does the intramembranous ossification take place? In the skull. One student in the other class said the brain. The brain is nerve, neurons, and glial cells. It's not bone. This is the skull around the brain. That one grows with intramembranous ossification. While the other bones, those are your vertebral column, your extremities, those grow through endochondral ossification. Yes.
So within this process right here, when the children are born like missing limbs, this is where something went wrong.
Missing limbs? What do you mean missing limbs?
Like say their arm is not fully developed.
Oh, so they're not missing it, but it is not fully developed. Right, exactly. Fully developed. So that's like a congenital disease. You know, this process of setting off mitosis, entering into the cell division cycle, going through the interphase, the S1, the G1 phase, S1, the G1 phase, the S, the G2 phase, this is the interphase, and then entering into the mitosis. Remember the prophase, the metaphase, the prophase, metaphase. Good God, prophase, metaphase, anaphase comes that soon? Okay, prophase, metaphase, anaphase, telophase, cytokinesis. This process, you know, like when you graduate, is highly tightly regulated with some enzymes. If these enzymes are damaged due to a mutation, a genetic disease, then we cannot go through the full cycle. We're going to stop there, like a broken clock. We're going to stop at one number. You cannot move on to the next stage. I forgot the cell. Oh, and this is on tape too. They're going to fire me. Okay. The diaphysis and the epiphysis. You see the baby is born with so many undeveloped bone, but the nails are okay. They can scratch you. My nephew scratched me. I look like Scarface. Yeah, you know, because the nail is not part of your skeletal system. The nail is part of your integumentary system. And his father was saying, because you play aggressive with him, he's gonna become aggressive. You know, fathers defend their kids. Yeah. Even in the court too. My son is an honor roll student. No, he was not. We have access to his anyways. Yeah, he was caught with a firearm. He's an honor student. Was caught with the wrong crowd. He is the wrong crowd. Anyways, the zone of the reverse cartilage. So now if you look at this epiphyseal plate, we're gonna analyze that epiphyseal plate histologically. We're gonna look at the different strata. You see that this epiphyseal plate that's gonna grow into bone and fuse throughout your development is actually different layers of tissues. Look, 1, 2, 3, 4, 5 zones. The first zone is the zone of the reserve cartilage. You know, cartilage can mature and become bone. Cartilage can harden up and become bone. Ever cooked something soft that hardens up? Cake? Cake is at the beginning is soft, then it hardens. Yeah, something. The bone is like that actually, but the bone is much hardens up way much more than the cake. So the typical histology of the resting hyaline cartilage, that's the zone of reserve. So you have a bank of cartilage. The next zone, you start pulling from that bank to the center, to the middle. So the chondrocytes are cells that secrete cartilage. We call them chondrocytes. Osteocytes secrete bone. Chondrocytes secrete cartilage. So the chondrocytes multiply and line up in rows of small flat lacunae, and the zone of the cell hypertrophy has secession. There is a cessation of mitosis. There's an enlargement of the chondrocytes and thinning of the lacunae walls. The zone of calcification is temporary calcification of cartilage matrix between columns of the lacunae, and there's a zone of bone deposition. That roll actually for me, I don't think I'm gonna eat tonight. So the best thing you should do is starve yourself and have one meal, and you will be okay. Yeah, it's very bad to eat. Also, all these animal meats are very bad. So you know you have to like train yourself to eat like animal meat like once a day. So begin with once a day, and then like thrice a week, then like twice a week, then once a week, then once a month. That'll be if you can do animal meat once a month, it's amazing. Yeah, that's my goal. The zone of the bone deposition is the breakdown of lacunae walls, leaving open channels, and then the chondrocytes die, meaning no more cartilage. If no more cartilage, that means no more what? No more bone, because cartilage is gonna harden up like cake and give you that bone tissue. No more cartilage, no more bone. I'm sorry. My prayer time. So I gotta go my prayer. I come back. We finish. How many more slides do we have left? 16 more slides. Yeah. Can we do it at where? No. Just 15 minutes, and then this is a very important chapter. 15 minutes we come back, we roll it up in like 15 minutes when I come back, and then we go home. Yeah, you know, life goes, you know, life changes. Okay, all righty. So you know, I'm gonna leave the recorder going on, and actually let me stop here. Yeah, let me stop here, and then